So this is a second video responding to questions left in the comments, as I find this is actually quite enjoyable for me. I think I might start coining this series my heart-to-heart talks. I'm just in Seattle this weekend for the SecureCon convention, and I'm just putting this video together at the workstation area of the Hyatt Regency Hotel, so you may see some people walk by behind me. This is a question from Adrian Moore, and thank you for sharing this question with the audience, as I think that this may resonate with a lot of people. So I figured I better do a video on this. The comment and question is as follows. I'm on River Roxaban for a PE I had 8 years ago. The doctor said that they didn't know what caused my PE. I've never had heart problems or anything, but at that time I was a trucker and I was eating McDonald's 3 days a week and KFC and Subways for the other days. I was also drinking heavy and smoking heavy, but now my lifestyle is completely different. So could it have been my lifestyle at the time that caused my PE? I have spoken to my doctor, but he just says that I have to stay on the tablets for the rest of my life, and I'm only 52. I was thinking of going down the natural way of taking garlic, ginger, etc., but I'm a bit frightened to make that leap. Do you have any advice for me or know anybody who deals with this kind of problem? Many thanks. First of all, Adrian, kudos to you for making such a drastic lifestyle change. It's probably one of the hardest things to really do, and I also find it kind of ironic usually that it's lifestyle and diet that kind of gets put off to the side a lot of the times when we're so busy working to provide for our own loved ones, yet at the same time we are kind of tempting fate and possibly shortening our own lives. So the question is, for someone who has had a remote blood clot years ago that may have been related to an unhealthy lifestyle, does one have to continue taking a prescription blood thinner indefinitely? This is a fantastic question on multiple levels, as it's very complex, as it deals with not only risk-benefit type things, but also patient values and preferences. The assumption is that, like myself, you are somebody who doesn't like taking medications and prefer to go somewhere down a more natural route if you had the choice. I think one of the key components of your question is embedded in the comment. So when we think about blood clots that form for a patient, we always think back at something called Virchow's triad, which is a framework and tool that clinicians will use to figure out the possible causes of the blood clots in the first place. If it is deemed something that is reversible, what we call provoked, and we remove the offending cause, then the odds of the blood clot returning or not dissolving on its own is likely going to be lower than if we otherwise didn't correct for that underlying cause. Go ahead, you can go through it, yeah. But remember, Virchow's triad is a guide and doesn't really detail the degree in which it poses a risk for an individual. For example, is advanced age more clot provoking than, say, somebody who smokes? It also depends on things like how much do people smoke. So there's a lot of little details to think about, but also dividing between provoked and unprovoked too can sometimes be a little misleading because not all factors are considered. Doctors like this approach of dividing between provoked and unprovoked because it's simple for the most part, but it's a lot more nuanced than that. I have a gentleman on my unit right now who has antiphospholipid syndrome, which is a blood clotting disorder, who actually suffered 4 strokes over the span of the last 15 years and has been on injectable blood thinners since. I have another lady who's got a blood clot in her leg, initially felt to be related to a long flight. Only to experience another blood clot in that same leg 12 years later while not being on blood thinners because they initially thought it was a reversible cause. Of course, your case is different. Yours may have been associated with your occupation at the time, the smoking. I don't know what your body weight was at that time. I don't know what kind of trucker you were, but it's been recognized by the CDC over half of the truck drivers, long-haul truck drivers in particular, have at least 2 of the following risk factors for blood clots: things like high blood pressure, smoking, obesity, high cholesterol, limited physical activity, and get this, less than 6 hours of sleep. If this is something that's considered unprovoked, the approach would be different, but of course it requires nuance, as I mentioned earlier. Honestly speaking, though, your story does sound like it could possibly have been provoked, but without having a blood specialist doctor weigh in and possibly do some testing for other possible causes that can thicken the blood that may be genetic, we really don't know for certain. Here in BC, Canada, we have the ability to do some of these tests in some blood clotting clinics that are run by internal medicine doctors and hematologists and pharmacists who help people with these blood clotting issues, and they try to figure out what the underlying problem is before committing people to lifelong blood thinners. I don't think it would be unreasonable for you to ask your doctor again to be reevaluated of whether you could be somebody who now have changed your life around. It seems like you've kind of talked to him already, because it does seem like several of your factors or possible risk factors that have been kind of corrected for. I wouldn't, though, stop your blood thinner without speaking with your doctor, obviously. But if you're getting the sense that you're not being heard by your doctor, it may not be unreasonable, too, to see if you can obtain an opinion from a different doctor as a second opinion. I assume that your doctor has already assessed your overall risk and deemed you as somebody who has relatively low bleeding risk, for why they decided to put you on the blood thinner instead of risking possibly a fatal blood clot. If you think about how this all works out medical legally too for your doctor, it would be seen as negligence if he just stops your blood thinner after 3 to 6 months, and then you end up having a catastrophic event. Again, too, especially with these blood thinners, it's always going to be a risk for clots versus risk for bleeding, and what your comfort level is for each of those things too. Dangerous bleeding can happen while on blood thinners as well, whether they're spontaneous or they're provoked or due to trauma. And they can be fatal under some circumstances as well. I always encourage an informed and shared decision-making process between you and your doctor, so that it's agreed upon by both ends that this is the right thing for you to do at this point in time. Regarding natural supplements, for your second part of the question, unfortunately, there will never likely be any good data on unregulated products like garlic, ginger, etc. So it's not something that I would recommend from an evidence-based standpoint, obviously. But if you and your doctor happen to come to a mutually agreeable decision on good informed data about yourself, including possibly some extra blood tests, and decide that the risk may be low enough now that you've change your life around, then it's probably okay for you to try some of these things, acknowledging that they may not work to prevent blood clots as well as actual blood thinners. Anyway, this is how I would approach the situation if it were my family member who's asking me that same question. Remember, as a disclaimer, please use this as education rather than medical advice, and make an appointment with your own healthcare provider to discuss some of these things that I mentioned if you see it fits. Thank you again for your question, Adrian, and I thank you all for tuning in, and we'll see you in the next one. Say no to drugs.